we're talking a little bit about the disc replacement. What exactly, doctor, is alternate, the disc replacement, the procedure?
Sure. So remember we discussed that approach to the spinal canal,
right here,
to the front.
Yes.
So, and remember I said that the old way of doing it was to put a metal plate with some screws that stops motion. Now, instead of doing that, the new technology includes a removal of the disc in the most sparing way possible, and then replacing that disc with a metal prosthesis that allows normal motion. Now, the prosthesis is made out of cobalt, chrome, and molybdenum alloy. That's the metal component, so it's not going to interfere with an MRI. It's not going to ring in the airport. And then there's a plastic piece that's made out of high molecular weight polyethylene. Now, these are the same parts that now have over 40 years of track record in the total hip.
Wow.
Now, the total hip sees 5 times the body weight at times, whereas the neck prosthesis only sees the 30-pound head. So the results of long-term studies have been really very promising.
Every story is different when it comes to that spine. I've heard of people saying, yeah, I've got this disc here and it's been bothering me, but I have no pain. And then I've heard other people that say, yeah, you know, and I'm terrible pain. Every person is different.
Absolutely, absolutely. But look, it's important to say, number one, that few patients need surgery. Number two, few back problems are dangerous, very few. So sometimes I'll hear patients say, well, I was told that if I don't have surgery, I'm going to be paralyzed. 99.9% of the time, that is not true. So it would be really important to follow the studies, and actually there's a great paper out of Yale published a few years ago, where they looked at patients who were in car accidents who already had some nerve compression. None of those patients were paralyzed, disproving this old myth that, oh, well, if you have nerve pain, if you fall, you may be paralyzed.
Right.
That is not true.